Nursing 474, Environmental Health. Your weekly learning objectives for week 10 include discuss the role of the nurse in epidemiological surveillance and primary, secondary, and tertiary prevention, apply the nursing process to the practice of environmental health, interpret basic epidemiological measures of morbidity and mortality, explain the relationship between the environment and human health and disease, explain how elements of epidemiological triangle interact to cause infectious disease. Your other learning outcome objectives for this week include provide examples of infectious disease control interventions at 3 levels of public health prevention, describe at least 3 potential implications on patients, families, and communities of persons knowing their genetic information, explain the relationship of the natural history of disease to the 3 levels of prevention and to design and the design and implementation of community interventions, collaborate with your preceptor and the healthcare team to formulate your initial problem statement based on analysis of the assessment data collected. Okay, Healthy People 2020 Objectives for Environmental Health. One of the priority areas for Healthy People 2020 is environmental health because of the long recognized importance of the relationship between health and environmental risk and underlying factors contributing to the disease. As in the 1995 Institute of Medicine study, Nursing, Health, and Environment recognized early on that environment as a determinant of health is deeply rooted in nursing's heritage. Florence Nightingale is known as the mother of biostatistics because of her work in compiling information on conditions affecting health. The relationship between environmental chemical exposures and their potential for harm became misunderstood through several historical discoveries. When humans present with signs and symptoms that can be connected to specific chemical exposure, when there are large accidental releases of chemicals into community that contaminate air, water, or food, resulting in health effects, and in rare instances when human environmental epidemiological studies have been performed. Environmental health sciences. Toxicology is the basic science that studies the health effects associated with chemical exposures for both quantity and time of exposure. Epidemiology is the science that helps us understand the strength of the association between exposures and health effects in human populations. Environmental studies and surveillance activities can help target scarce public health resources to address environmentally related diseases and occupationally related illnesses. Scientists are now approaching epidemiology at the molecular level, looking at gene-environment interactions. Multidisciplinary approaches, there's a number of earth sciences that help us to understand how pollutants travel and how they can affect humans. Global warming and the associated long-term warming trends over the last century have been well established, and climate change scientists are projecting substantial disruption in water supplies, agriculture, ecosystems, and coastal communities. There are 2 concurrent roles for nurses: mitigation and response, which includes preparation, disaster preparedness, and mobilization, and migration response. A number of approaches for assessing environmental health risks are available, including such approaches as risk by media and risk by functional location. But in all cases, nurses must determine whether exposure is in the air, water, soil, and/or food, and whether it is chemical, biological, or radiological exposure. The National Library of Medicine has developed some of the most useful, comprehensive, and reliable sources of environmental health information on its website, ToxTown, that's T-O-X Town, including a household products page. The I Prepare mnemonic, which stands for Investigate Potential Exposure, Present Work, residents' environmental concerns, past work, activities, referrals, and resources, and educate can be used when interviewing an individual client or assessing a family, or can be adapted for community use. Environmental health assessment using a windshield survey helps one understand the potential environmental health risks in a community. Air pollution should be assessed from the perspective of outdoor air pollution and indoor air quality. People's lives are tied to safe and adequate water. Therefore, water sources used to grow food, public water suppliers, and private well water should be addressed. Land, current and past land use can affect a community's health, and local governments dictate land use through zoning laws. There are two designations for land that has been contaminated: Superfund sites and brownfield sites. As far as food production, processing, modification, and preparation are another area of assessment. You should all be familiar with the right to know. This is several environmental statutes give the public the right to know about hazardous chemicals in the environment. EnviroFacts scorecard put out by the Environment Protection Agency reports major sources of pollution to air or water by community. The Consumer Confidence Report provides water providers are required to test and report the finding to those who purchase water. The Freedom of Information Act is a federal law that allows citizens to request public documents. OSHA, or the Occupational Safety and Health Administration, puts out a hazard communication standard. This requires employers to maintain a list of all hazardous chemicals used on site. Each chemical has an associated chemical information sheet known as material safety data sheets. You may know this as MSDS sheets. Risk assessment is the process to determine the probability of a health threat associated with an exposure and typically involves 4 phases. Both point and non-point sources should be considered. Risk assessments are subject to interpretation and areas of scientific uncertainty. The first phase determines whether the chemical is known to be associated with negative health effects in humans or animals. The second phase determines whether the chemical has been released into the air, water, soil, or food. The third phase estimates the quantity, route of entry, and duration of the exposure. The fourth phase brings all previous phases together to predict the potential harm based on estimated exposure. Assessing risks in vulnerable population. Children's environmental health. Current childhood health statistics have raised the question of environmental factors in growing rates of such conditions as asthma, autism, and mental health. Developmental disorders, attention deficit disorders, child and adolescent obesity, and several forms of cancer. When assessing childhood environmental factors, it is important to note that children are not just little adults, and their bodies operate differently from a physical and physiological perspective, such as stature and respiration rates. Toxic chemicals can have different effects depending on the timing of exposure, for example, during fetal development. Reducing environmental health risks. A basic value of all public health initiatives is prevention and education as primary prevention strategy. Surveillance is a secondary prevention strategy, whereas swift medical intervention is a tertiary response. Risk communication is an area of both practice and skill. For workplace exposure, the industrial hygiene hierarchy of controls provides a risk management approach to eliminate or reduce risks, also known as the 3 R's: reduce the risk, reduce the exposure, and reduce the presence. Risk has traditionally been formatted as magnitude, the size, severity, extent of area, and population affected, multiplied by the probability, how likely exposure or damage is to occur. The outrage response, relevant to the risk, is another predictable factor to consider and should be incorporated into the message to address necessary action, safety considerations, prevention of harm, or reduction of fear. The risk communication should include the principles of the right information to the right people at the right time. Understanding ethics is essential for nurses in making their own choices. Describing issues and options within groups and advocating for ethical choices to shift conversations from either or to both by opening new possibilities for ethical and mutually satisfactory outcomes. Governmental environmental protection may include such activities as managing environmental exposures through enforcement of standards and regulation, public education, federal, state, and local government collaboration, and environmental permitting, compliance monitoring, and remediation. As trusted messengers and reliable sources of information, nurses should have a strong voice for a healthy environment and have a responsibility to be informed and take action in the best interest of the public health and therefore advocate. Environmental justice and environmental health disparities. There are campaigns in the communities of color and poor communities to improve the unequal burden of environmental risks, and they're striving to achieve environmental justice or equity. Certain environmental health risks disproportionately affect poor people and people of color in the United States. Unique environmental health threats in the healthcare industry. There's new opportunities for advocacy. Such activities are as reducing the use of mercury-containing products in hospitals and lowering the level of persistent bioaccumulative toxins. Persistent organic pollutants and dioxins have grown into an international campaign called Healthcare Without Harm, founded by the ANA. There is no single source of information regarding environmental health, nor a single resource to which an individual or community can be referred should there be a suspected environmental problem. The National Library of Medicine's Toxtown is a great starting place, and the APA is another rich resource. As far as nursing roles, the roles for nurses in environmental health can cover community involvement and public participation, individual and population risk assessment, risk communication interventions, epidemiological investigations, and policy development. As nurses learn more about the environment, it will become evident and will involve. Opportunities abound for those pioneering spirits within the nursing profession who are dedicated to creating healthier environments for their clients and communities.